Last year, CMS devised a new rule to determine whether or not a Medicare beneficiary would be considered an inpatient or an outpatient during their hospital stay, solely based on whether their hospital stay spans more than 2 midnights. And while it helps clarify some issues, we've all heard about beneficiaries spending a week or more in hospital under observation status, the rule fails to acknowledge an instance where a beneficiary needs a high level of inpatient care for a shorter amount of time, even if the physician determines it's medically necessary or appropriate. And I think CMS has already acknowledged that there are problems with the rule and has delayed it on a number of occasions. Additionally, Congress just stepped in and imposed a statutory delay as part of the recent SGR bill prohibiting enforcement until March 31st of 2015. I have a bill with several members of this committee who have co-sponsored called the 2 Midnight Rule Coordination and Improvement Act. But what's more important to me is that CMS has the existing authority to implement the provisions of this bill, which basically is to have CMS consult with outside experts like hospitals and physicians to develop the criteria and methodologies that ensure beneficiaries in need of a short stay inpatient care are able to receive it, and to make sure we don't have those long stays when they're not necessary. So can you give us some sense of whether we can make progress here without necessarily dealing legislatively with it?
Well, I think the fact that Congress, as you say, has chosen to delay the implementation, we will certainly be looking for strategies. I know there was a lot of consultation earlier, but I would love our staff to circle back with you and your staff to see what the elements are in the bill that we could perhaps move forward on an administrative basis.
All right. Thank you. Senator Fisher, it's a bipartisan bill, so I hope we can do that.
Great.